Board of Public Works and Safety meeting to order. It's Tuesday, August 31st, approximately 10:04 a.m. And Pledge of Allegiance. Chief Snyder.
I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Do we have public comment? Anybody online for public comment?
I'll keep an eye on it.
All right. New business, update employee communicable disease policy. Jen Knoll.
Good morning, Board. Thanks for joining us this morning and being flexible with your time. As you may have recently seen, Governor Holcomb extended the public health emergency another 30 days with the surge of COVID-19 positive cases as well as the Delta variant across the state of Indiana. So from that order, there were some alarming statistics. 52.4% of Indiana residents eligible for the vaccine are vaccinated. The 7-day positivity rate went from 2.1% 2 months ago to 10.9% today. As of August 15th, 981 of 1,000 residents admitted to hospitals were unvaccinated. And 189 of 195 COVID patients in the ICU were unvaccinated. Because of these numbers and the increase of COVID-19 positivity rates here in LaPorte County as well, we felt that it was imperative that we address this internally with our staff. So we've updated our communicable disease policy probably for the 10th or 12th time. So I just want to highlight some of the things that we have updated here. Under the COVID-19 specific protocol, we've got a special statement there just noting that on August 23rd, the U.S. Food and Drug Administration announced that it had approved the Pfizer BioNTech COVID-19 vaccine for those who were unsure of whether they wanted to be vaccinated because none of the vaccines were FDA approved. So there was one that was recently approved by the FDA. Moving on to the section for unvaccinated personnel. All unvaccinated employees are required to always wear a mask when indoors or in a vehicle with other employees during the workday. Temperature checks are required before each shift. Continue to socially distance and wash and sanitize hands frequently. The first day of each employee's work week, 3-day duty rotation or 4-day duty rotation, they're required to get a COVID test. This must be from a lab or clinic within LaPorte County. HealthLink, CVS, Walgreens, Health Department, et cetera. Those are all qualified testing centers. In addition, on the city's website, we will be updating our homepage to include the extensive list that was provided by the Healthcare Foundation of LaPorte as to what other testing sites are available here in LaPorte County. And that webpage is hfllaporte.org/vaccine-testing. So again, that'll be on the city's webpage here today. Employees with no symptoms may work pending results if it's not a rapid, and a copy of those results is to be sent to HR on a weekly basis. There will be exceptions to those who have a medical condition with a physician note or written religious doctrine that would prevent them from either wearing a mask or getting a COVID test. And then what if an employee is exposed or tests positive and they're unvaccinated? So symptomatic and asymptomatic unvaccinated employees with potential exposure as determined by contact tracing would be required to quarantine for a minimum of 7 days with a negative test result. The test must occur on day 5 or later. This is in compliance with the CDC guidelines. And then employees who test positive will need to quarantine for a minimum of 10 days and present a negative test result prior to returning to work. For vaccinated personnel, these employees are still required to abide by all precautions while at work, including socially distancing, taking temperatures, and regularly washing or sanitizing hands. At this time, we're not mandating that they wear masks if you're vaccinated. Employees who are asymptomatic and potentially exposed but have received the vaccine This is also per CDC guidelines. No quarantines required. However, we do encourage you to monitor for the onset of symptoms and wear a mask indoors for 14 days following exposure. And then a test is recommended 3 to 5 days after that exposure. They're not required at this time. And then employees who are symptomatic and vaccinated report symptoms to HR or the supervisor and get a COVID test, remain off of work and quarantine for a minimum of 7 days, again with that retesting after 5 days, and then presenting a negative test result before returning to work. And then employees who test positive must follow the same quarantine guidelines as those who are unvaccinated, quarantine for a minimum of 10 days and present a negative test result prior to returning to work. We did send a copy of this communicable disease policy to both of our unions. We did receive some feedback from the fire union regarding the potential for mandating masks for both vaccinated and unvaccinated personnel because of their positions. And I just want to state that this policy is kind of the minimum that we're applying here at the city for all departments. Public safety, police, and fire can certainly be more strict in their policies internally at their departments. So if they want to enforce a mask mandate for all personnel, each department is able to do that.
Do I have a motion to approve?
So moved.
Second.
I have a motion and a second discussion. Jen, and as a part of this was really dictated, so I'm going to ask Chief Breton and Chief Snyder maybe to share their brief thoughts, but it's kind of what brought this to a head and the increases, but we need to keep our public safety in check and make sure they're available, healthy, to protect and help our community. So, Chief Breton, do you want to start?
I currently have 3 officers that are positive, that are on quarantine. So we actually started the mask mandate, I believe I talked to you Friday. We started it. And we're requiring anybody that is not vaccinated to wear a mask unless they're in their office alone. So it's something we're taking serious. We can't, the 3 officers that have it are really feeling the pain from it too. And we're hoping this is, now everybody's producing their cards that they previously didn't turn in, and we have, our newer officers have been going in and getting their first shot, so.
So the 3 that are ill are feeling
Yes.
ill.
Yes.
And that's our biggest fear, is to help protect unvaccinated as well as vaccinated employees as a whole. Chief, you're seeing the same situation.
Exactly. And our department, we've gone for months now without any positive cases, and to reflect what those numbers that Jen's talking about, we have 3 also off on COVID right now. And, you know, I guess to give a shout to the vaccinated versus unvaccinated, the one individual is vaccinated out of the 3, but he has also indicated that he can tell from his body what it would be going through if not. The other 2 are feeling it much worse than what he is. So,
Questions for Chief Snyder or Chief Breton?
Are we doing contact tracing? So if they were, either in either departments, and then those,
individuals were immediately that, once they were tested positive, went back to their last shift, depending upon the time frames. Those people were immediately relieved from duty, sent home until they got a test. Again, some of the things that we're finding with the Delta variant is the time frames and what Jen talked about have been extended a little bit as far as testing. One of those individuals tested negative, and then 2 days later tested positive. And we were using the time frames of the original policy, like 3 days, and he tested positive at about 5 days. So something that it's been something we've had to, adapt to throughout this thing, and this is another step of a precautionary measure to adapt.
And ours have been on 3 different shifts, ironically, and yes, we did go back. One's in a specialized unit, and he informed us last week, that's when we started the mask mandate, that his wife had it. We had him get tested, he was negative. He went Sunday, he was positive. So we are taking it serious, and we're doing all the, we're contacting everybody.
So is any evidence that, so it sounds like these were probably that contracted outside of, their role with, okay.
Each one of
Fair
ours
state.
have been traced back to contracting and contacting them outside.
Okay. I got a question for Mr. Otis. So regarding like this policy, I assume that you've reviewed this for legal compliance and everything's
Yeah, so
appropriately-
one of the issue that we discussed was compensation. If it's work-related that we're asking people to get tested, they do have to be compensated during that time. So that was the one issue that we worked through.
Which I don't agree with, but I know Jen confirmed federal law requires us to do so.
Right, so sometimes we have to tell you things you don't like, Mayor,
Just want to make sure you hear my side.
yeah.
As well, we've heard from some department heads that we could be having an issue with employees that may no longer want to work here, and we appreciate all the efforts that they've made to help make our community better, and we will help people find other opportunities for job employment. I do think it's going to be difficult as you see more of the private companies that are requiring to be vaccinated before they'll be hired. But hopefully people will see the bigger picture here and do what will help everybody. Again, unless there's a medical issue from their doctor or a religious a religious doctrine, we hopefully will see an increase in vaccinations so people don't have to go through this. But if you look at Jerry Jackson, not to put him on the spot with wastewater, the latest data that you gave us, do you mind, if you can remember, I didn't ask you to bring it, but we saw a further increase in the wastewater numbers.
Yeah, the trend has definitely been up. It jiggles around, but if you put a straight edge on it, we're definitely going up. And we've been running somewhere between 30% the 30th percentile compared to other cities for the concentration of virus in the wastewater, up to we had one that was 80th percentile. So we've been jiggling around between really around 30 to 60 in the percentile samples.
And if you look at Jerry's graph, it literally, and I don't know if it was 6 months, it was flat. There was nothing, and then it's just boom. So we know this is the time of period we're going to see increases. So again, this job, any of these jobs are not worth somebody's life, their family, and what people have to go through. So I hope they recognize we're trying to do what's best for all employees. Each city council member was contacted by me to last week at the end, including Roger Galloway. Roger, I don't know if you'd like to come up and, we had a 7-0 support of this ordinance update. All 7 supported it. Roger, anything you want to add if you want to come to the mic?
No, I don't want to come to the mic. It's me, we got to do something.
Mayor, I guess,
Mayor, did you want me to come to the mic?
Please. Thank you. But you were asked along with other members of, all members of the council, and it was 7-0 from a perspective that you support.
Well, I've had my shots. I got a daughter, a couple daughters, grandkids that they refuse to get them. To me, we should have them. We have a variance. We don't know exactly what's going on here again, and we can't have half our departments in down. I mean, let's face it, we got to do something.
And thank you for the support of this.
Yes, you called me personally to make sure I did, so.
Questions for Councilman Galloway? Thank you.
Mayor, I guess just from a legal perspective, going back to Mr. Kozier's question, from a legal perspective, the employer can mandate the vaccine if they wanted to. We're obviously not going that far with this proposal, but other requirements that you're seeing from Fortune 500 companies is raising insurance rates for non-vaccinated persons. I had discussions with people. I think some people find that not fair, but it's no different than having different auto insurance rates depending on the risk that you have based off of your driving history or health history if you've been a smoker or something like that. So again, the city hasn't gone that far, but the city could go further, I guess is my point, Mr. Kozier, if it wanted to. And you're trying to find a balance here between respecting people's personal choices and the bigger risk at hand of our departments that, everybody just expects the toilet to work when you flush it, or the fire department to show up when you call, or the police, and if we don't have enough people, that's not gonna happen.
In our departments, we do well. I'm proud of this team, and I'm proud of the people that work for us. So we hope everyone understands what this update does. And I think lastly, I was Bert Cook from an economic development perspective, you speaking to if you want to come to the mic, just hearing from the employers in the area that are having to address this and are struggling with individuals because of this vaccine or lack of vaccine.
Yeah, good morning, Mayor and Board of Public Works. I think it's universal. I mean, from the companies that we talk to on a regular basis, there's some form or fashion, as Attorney Otis referenced. I think there's different ways to sort of attack trying to encourage people to protect themselves and get vaccinated. So I hear a wide variety of different approaches to this, with testing for those that are not vaccinated, as well as, obviously mask wearing. So I think I'm not sure if I've heard of a single company in our community that is not enacting some sort of protocols to try and help encourage, the overall safety of their employee population.
Thank you. And my goal is still to have everybody live their life. I mean, we've got Brett Benversi here, and we're trying to provide entertainment options at the Civic Auditorium, and we want to continue to do this through these pandemics, and hopefully being vaccinated will help us get through there. But we don't want to slow down the opportunity that sits in front of us at the Civic and other venues. So with that, are there any further questions?
There is, on the second page, there's a statement under the hiring and employment section. The very last sentence in that entire thing says the city reserves the right to revise the policy without notice during changing pandemic conditions. So this could continue to change without us meeting to vote on this policy. Is that correct?
No, I mean, so essentially, this policy is kind of a working document, but we would still come in before the Board of Works to change it and approve it, if so
Okay.
inclined, yeah. And I guess to Nick's point, regarding the increase in insurance premiums that has been talked about here internally, it's not something that we feel that we want to do at this point, but I just want to point out that based on the vaccine cards that I have in my office, we only have 35% of city employees that are vaccinated, which is a pretty low number, especially even in comparison to the state of Indiana as a whole, which is at 52.4%. So if we don't see that number increase, or we see an increase in COVID related staff shortages, then we might be looking at some harsher guidelines here.
So if an employee wants to get vaccinated during company time, is that going to be paid for?
Yes, because we want to encourage it. And to schedule a vaccine, employees can go to rshot.in.gov to see when time slots are available.
And they're all made aware of that regularly?
They will be.
Posted in departments, department heads?
As well, department heads will be responsible for managing their staff, speaking to them, we hope, today. Jen will work with them to make sure everybody understands the new policy, and we will provide them as much support if they want to get vaccinated, to get that done.
Correct.
I'd make one more comment too, talking about the healthcare costs, and I don't know what the specific cost, Mayor, you may want to ask Dr. Leonard, I'm sure he could probably provide that, but I regularly do litigation work. I see emergency room bills. A minimum emergency room bill is $2,000 to $3,000. That's for just base, just in and up there. If you're going to be at the hospital in the ICU, that's a $5,000 to $10,000 bill, and then if you're probably going to end up on a ventilator, you're probably looking at 15 grand. I mean, I totally get why employers are going to say, look, we're passing this cost on to unvaccinated people, because it's not even close, the statistics of what unvaccinated versus vaccinated people being hospitalized.
I'll just make a couple comments. I mean, I think what we're talking about, and Mayor, you alluded to it, I mean, we're talking about public utilities that are absolutely a need, for people, for our community, and then emergency services, in which case you've got situations where people might, our first responders may expose to, or may expose anything they may have to a resident, that, you can't plan for any of that. So these are kind of unique situations. But then beyond that, I think it's very important for us to make sure to do what we can to kind of protect both the staff. The one other comment, and Mr. Rhodes, correct me if I'm wrong, because this is from my discussions with more of my internal attorneys where I work, which is a very large international company. The providing that information, because I think Chief Breton or Chief Snyder may have mentioned that not everyone provided their cards initially. So I've heard that, there's HIPAA, it's a HIPAA issue, it's a health and information privacy issue. Correct me if I'm wrong, but providing your vaccination status is not a HIPAA violation. It is not protected information. If you're not vaccinated and there's a reason behind it, that piece is protected.
Correct, right.
That's a very key difference. So I think it's just important for people to know, because I think a lot of people make the assumption that that information is protected, health information, but it is not.
Correct.
stats.
It is not HIPAA protected. We're not a healthcare provider. The city is not. So we're not subject to HIPAA rules necessarily. Obviously, Jen does come into, handles a lot of confidential, personal information, but there are people that may be exempt from getting the vaccine, and that's why maybe we haven't gone to the mandate yet. But if you have a disability that puts you at risk, that's a totally different thing, and that would be handled confidentially within the city if we get to that point where it's mandated. But the vaccine card is definitely not HIPAA protected.
And I can tell you, this is the last discussion we want to be having again after last year, but it's the reality of the situation we're in. So I'm sure it won't be the last time we meet here to discuss this policy. So further questions, concerns? Anybody from the public? Last opportunity to speak or online?
No public comment.
Okay. All those in favor state by saying aye.
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 Opposed? Motion passes 3-0. Thank you, Jen.
Mayor, I do have one thing I needed to bring up real quick.
Yes.
2 weeks ago, you passed a resolution for 709 Maple. That has to be then published, a notice needs to be published in the newspaper, and it needs to be done within 10 days. I did not get that done within 10 days. I'm just asking for you to reapprove that, so that way I'm gonna have it in the newspaper this week. So if I could just get a motion reapproving the highest and best use of 709 Maple.
And that is the
colorful
house here.
No, that's the vacant parcel that
Oh,
used to
yes.
have the 3 units on it.
Yeah.
So
Do
I just didn't get it in the newspaper in time, and the statute says 10 days, so.
Do I have a motion to approve?
So moved.
Second.
I have a motion and a second. Discussion. All those in favor state by saying aye.
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 Opposed? Motion passes 3-0.
Perfect. I got the resolution right here, so I'll pass that down.
Do I have a motion to adjourn?
So moved.
Second.
I have a motion and a second. All those in favor state by saying aye.
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 Opposed? Motion passes. We are adjourned.